Well, let's talk more about this with Dr. Anne Rimoin. She's a professor of epidemiology at the UCLA Fielding School of Public Health. She's in Los Angeles and joins us live now. Professor Rimoin, thank you very much for being with us. The spread of Omicron, clearly a huge concern. Christmas just over a week away. What worries you about this, and what can we do to mitigate against the virus taking hold even more?
Well, thank you for having me. I think that the things that we need to be really worried about is this incredible momentum that the Omicron variant is now starting to gain. We're starting to see cases everywhere. People are already starting to travel for the holidays. They've already made their plans. And so I think it's going to be very difficult to get people to pivot or change plans. So we have to get very clear about what people can do to be as safe as possible. And those things are, of course, getting vaccinated, getting boosted if you are already vaccinated, wearing very high quality masks, throwing in testing where you can. If you're going to be gathering with people, get tested, use rapid tests if they are available to you, and be creative. Open windows, open doors, spread out, and be very thoughtful about how you're going to be spending time with people and what their risk factors are, because this variant is extremely contagious.
You've done lots of work around vaccine hesitancy. Why are some people hesitant about getting the vaccine?
This is an interesting question because the answer, I'm not going to be able to give you just one answer. There are myriad reasons that people are hesitant. Some people are worried about side effects. Some people are worried because of misinformation that is being spread about this vaccine. Some people are concerned because of experiences that they've had that have been very negative with the health system. Some people just don't have enough information, and so it's going to be very important to be very specific with communities, address their concerns individually, and really be able to help people understand from their own perspective what the vaccine can do for them, how it can help them get back to normal, how they can be helpful to their community and protect other people. But a one-size-fits-all strategy is not going to work.
Last year, many people couldn't see family and friends over Christmas. Do you think there's a chance that even though they know the risks, some people this year, because of last year, might decide to take the gamble and have these family reunions?
Absolutely. I think that a lot of people are going to. And the bottom line is it's going to be about risk threshold, what people are willing to risk. Now we have so many tools at our disposal to be able to see people much more safely. As I said, we have vaccines. This is a fantastic way to be able to see people. If you do get this virus, it is very likely going to be much less severe. You're going to be unlikely to be hospitalized or die if you are vaccinated and boosted, for example. But as I said, masks are a terrific tool. They should also be used. Ventilation also should be used. And as I said, testing also should be used. So there are so many things that you can do. If you're going to get together with your family, you have to recognize that there's risk involved, but there are tools in the toolbox to make it as safe as possible.
Okay, we'll have to leave it there. Professor Anne Rimoin from UCLA, thanks very much for being with us.
It's my pleasure.